buffering system. An example, sodium bicarbonate system, phosphate mechanisms in the cell. The rate of progression with shorter rest protocols produces symptoms, nausea, dizziness, vomiting, fainting, that are counterproductive to optimal intensity and healthy lifting. Too great an acid load too early in a training program can lead to overtraining. Furthermore, serum cortisol elevation with exercise may not return to resting levels following the workout. It is possible that the catabolic environment this cortisol elevation causes, together with free radical formation, can contribute to further tissue breakdown. Mistakes in the rate at which rest periods are shortened can augment overtraining syndrome that may be starting from an other source. An example, too much exercise volume. Markers of anaerobic overtraining. The previously mentioned physiological response to anaerobic overtraining may be markers of an overtraining syndrome. The endocrine response, however, appears to require longer than 1 week of monitoring to serve as an adequate marker. The most effective markers are those associated with sympathetic overtraining syndrome because it may be the first response to anaerobic overtraining. Being watchful for overtraining-related performance decreases prior to the occurrence of a full-blown overtraining syndrome is vital. Yet, markers of overtraining are few in anaerobic training. A recent theory of the mechanisms of overtraining proposed that the central nervous system neurotransmitter serotonin is produced excessively. Serotonin is often associated with sleep and fatiguing conditions. The serotonin precursor, tryptophan, competes with the branched-chain amino acids, valine, leucine, and isoleucine. When crossing the blood-brain barrier, it has been theorized that dietary supplementation with branched-chain amino acids would decrease the levels of serotonin in the brain. Overtraining and supplementation studies with weightlifters, however, have not supported this theory. Markers of anaerobic training. More research is needed to clarify the monitoring problem. To date, only a few possible markers exist. Psychological effects: decreased desire to train, decreased joy from training. Acute epinephrine and norepinephrine increases beyond normal exercise-induced levels, sympathetic overtraining system. Performance decrements, although these occur too late to be a good predictor. Unfortunately, because of the limited markers available for anaerobic overtraining, many athletes and coaches monitor the markers of aerobic overtraining while typically not working to monitor anaerobic overtraining.